keynote speaker. I'll just quickly take a quick reading of our profile, and then we'll hand over to Dr. Adetutu. All right. Dr. Adetutu Kuniji is a medical doctor with over 16 years experience in physical and mental health, including 9 years within the CHAIR's United Kingdom. She's a specialist in general health, adult pediatrician, and a member of the Royal College of Psychiatrists, UK. Our experts expands a wide range of psychiatric conditions, including depression, anxiety disorder, prenatal mental illness, covering women's mental health during and after pregnancy, addiction, eating disorder, and stress-related presentations. She holds additionally certifications in medical education and infant mental health, both from the University of Warwick and medicine from the University of South Wales, alongside workplace well-being and mental health first aid. I believe that we are all anticipating what is coming next. Right now, I'll just hand over to Dr. Adetutu. It's good to have you here, Ma. Thank you.
Good morning. Thank you so much for your introduction, and it's amazing to be here today. I'm really pleased, and thank you, Aspire HMO, for what you're doing. It's really amazing that someone is taking the time to look after women the way you're doing. And so, yes, thank you so much for today. I'll go straight into it. I'll be talking on mental stress at work. What is the hidden cost of the capable woman? But I would like for this to be as interactive as possible. So along the line, I'm going to share some QR codes, and I'll like people to get on their phones and be able to interact with me as we go on. So I'm getting right into it because of time. I wonder how many of us are feeling a bit stressed at work lately, and just think around it a little bit. Think about that question a little bit if you have been feeling stressed at work lately. And then I'll go a step further to ask how many people have actually done something about it in the last 1 month. So what we find is that a lot of people there's a gap between knowing that we're stressed and doing something about it. And hopefully today we'll be able to close that gap. So many organizations invest very heavily in their physical health benefits for their, staff. And that's why you'd find people having access to, HMO services. And many people, are not feeling well, or I've got high blood pressure or whatever. Yes, people are very well supported, but mental health in organizations are still developing. The framework around that is still developing. And, a lot of people are not sure how to plug in, how to support their staff. And hopefully today we'll be able to touch a little bit on that. So here is my first poll for the day. I'm wondering if we can try to figure out in your workplace, where does work-related stress most often come from in your organization? Is it from deadlines? Is it from staff shortages? Is it from poor communication? Is it work-life balance? Is it leadership expectations? I'm told that there's, mid to senior level managers on this call today. And so it'll be interesting to hear what you think. The moment you start putting something in the chat, I'll start seeing the poll move forward. So I'll wait for a minute before I move on. Amazing, amazing. So we can begin to see what the poll is looking like. A lot of people saying that they're having issues with work-life balance. Work-life balance seems to be something that we get a lot when we do this sort of workload and deadlines. Thank you. Yeah. So I think it's rather split. Okay. Okay, interesting. Some people are talking about staff shortages. Okay. And so this is some of the things that can happen in organizations. I'm going to move on because of time, but I think that quite a lot of people are talking about workloads and deadlines. Well, my aim today is that after my talk, I'm hoping that by the end of this session, you'll be able to recognize how mental stress occurs in high-performing employees and how chronic workplace stress affects productivity, and then simple, tricks that can help to reduce burnout risk in our staff. I saw that in the expectation earlier on, someone talked about things like this, that how can we prevent things like this? So I'm hoping that will answer your question. I'll move on very quickly to the different kinds of stress that probably exist. There's acute stress, chronic stress, and then there's something that the WHO actually recognizes as called burnout. Acute stress is normal. It is actually completely useful for you as a human being. So, for instance, I know I'm giving this talk this morning, and so there'll be certain things I'll do to prepare for this talk, and that is the acute stress and preparation phase. It helps you put your best foot forward. So that is really welcome and it's good for you as a human being. It's expected as well. But then there begins to be a problem when there's chronic stress. Basically, your body is constantly in fight or flight mode, constantly. And this causes even your hormones in your body to change. And so there's something called the stress hormone in our body, and that's cortisol. So you have elevated levels of cortisol. Your amygdala in the brain is constantly firing, and your body is trying to fight off, like it thinks that there's an imminent threat coming up. And so this is some of the things that your body begins to respond to this, even though there's nothing going on. Now, that begins to be a problem. If that persists for a long time, then we have what is known as burnout. Now, burnout, like I said, is recognized by the WHO as a clinical syndrome, can have emotional exhaustion, depersonalization, collapse of personal efficacy. So you're unable to meet up with the tasks that normally would not be a problem for you. And unfortunately, women have this a lot, and it is very underreported. Lots of studies have shown that less than 55 women and 55% of women actually go through burnout, but they don't talk about it because they're afraid of possible consequences. Men find it easier to talk about what they're going through than women. And so that's why I'm talking about this morning, because women can be high performers in the workplace, and unfortunately, they burn out and then they're not talking about it. Now, I'll move on to talk about the invisible tasks that a woman goes through. So, just because of our nature, our maternal skills that we've got, it's innate, right? We manage to carry the emotional labor of our organizations sometimes. You're managing every other person's feelings at work. You're checking to see that they're fine. You're the one who's noticing someone who's frowning. It is a lot of work. It's emotionally draining, but it is a work that is rarely recognized and unfortunately is sometimes a thankless job. Also, we move on to the cognitive load that women carry. And so you're there managing relationships, expectations, consequences, so that things don't go bad around you because of the way we're created normally. The last one is one of our greatest problems. We have the permission debt that we have as women. So, for instance, your calendar is full, you can't make XYZ, but you've been asked. Women find it very difficult to say no to things that they cannot do. You find that many times men don't have this negotiation within themselves. It is not something that you're able to do. But women would find a way to say, oh, if I say this, they're going to feel one way or the other. No, if it's boundaries, you just need to be able to, as long as you've done your important job, extra work, if you're not able to take it on, we should be able to say so as a woman, but we find it more difficult to do these things. And that's why I say that women don't burn out dramatically. They often burn out very efficiently. They continue to do the work and do the work, and unfortunately, eventually, they're not able to do it anymore, and then that's it. And many organizations, they have their highest performers carrying these invisible pressures we talk about for many years before anybody recognizes that there's something wrong, or silently they just disappear, these women. And then the whole thing comes crashing down because you don't know the impacts that this woman has been carrying in your organization. Now I'm back with another poll. I want to know, in the past month, how often have you felt mentally exhausted after work? How often? Okay, we're already having some feedback sometimes. Okay, rarely. Yeah. So what I want us to begin to think of is to be more aware of our mental state, basically. And as a quick reflection for some people that I have not answered yet in the polls, I want you to think around sometimes you feel if you're feeling mentally exhausted after work, or you're carrying responsibilities that are not formally recognized, or you delay asking for support until you're struggling, you don't want to speak up, you need more support, you don't want to ask for it. The team relies on just a few people, that when this person is there, things are done. But it shouldn't be that way. It should be a shared responsibility. So if there are two or more of these symptoms you have, it may be a systemic issue rather than just an individual one in that organization. Again, I'm going to talk briefly about some things that should get us thinking around how we're faring in the workplace. So are you beginning to have sleep challenges? And sometimes so you can't fall asleep, or you have broken sleep, or you end up having just 2 to 3 hours of sleep overnight. And this is continuing for more than 2 weeks. That is a problem. You're very irritable. You're just snapping at everyone and their grandmothers, so that is another problem. Emotional numbness, you just feel flat. You can't really tell. It's not that you're unhappy, it's not you're sad, but you're just really flat. And loss of motivation or enjoyment for enthusiasm for things you used to enjoy. Or you've got an unexplained physical illness, as I've told you. These things cause some high stress hormones to come up in our bodies, and so can actually lead to illness. Or even you're dreading going into work physically. Sometimes it's Sunday night and you just can't even tolerate the thought that you're going to work on Monday. So if three or more of these are true, these are clinical data that your body is telling you that there's something going on, you need to look into it. So now, what is the cost of people feeling like this in your organization? Unfortunately, in Nigeria, we don't have a lot of data, but I'm bringing UK data, and this is the picture worldwide as well. So up to 24 billion pounds is seen as the cost of presenteeism in UK organizations annually. What this means is that people are present at work, but they're not efficient, and so they're not able to deliver on what they're supposed to be able to do. And so that is a cost for the organization. Now that data was gotten by Deloitte. Right. And then when this begins to happen, of course, there are lots of deadlines that are missed, some people that are doing the work, then there's higher burnout risk for those people that are carrying the invisible loads that we've been talking about. And then eventually, unfortunately, they begin to burn out and then they silently exit the company. So that is a lot of high turnover for companies that have these structures that are not properly put in place. And so basically, I like to say that you cannot build a resilient organization on the backs of women who are not allowed to be anything other than resilient. In Nigeria, we think just try harder. We need to be, in fact, I think one of the big badges of honors of Nigerians would be we're very resilient people. It shouldn't be that way. We should think around how can we make things more conducive for people around us, rather than how can you be more resilient. And so now going to the practical things that we can do to change this in your organization or personally for you. For me as a person, I need to name it, what's going on. Don't just say, I'm stressed. That is very broad and doesn't mean anything. But if your brain is able to identify what you're going through, I'm carrying too much emotionally, or I haven't been able to sleep properly in the last 2 weeks and I've not told anyone about it. Irritability is an issue, be able to name it. And when you're able to name it, then your brain switches into problem solving mode rather than continuing to function in stress. For your organization, you need to ask a question. It shouldn't be. I mean, I know that many companies probably have well-being, talks or something every now and again. It shouldn't be whether we have a well-being program. It should be that how accessible is this for people that actually need it? There are punitive measures in place for people when they ask for more support in terms of their mental health. Would you think, oh, they're not mentally fit, so they cannot be appropriate for promotion the next time it's going on? So it's things like that. The answer for most companies is that no, this is not there. But how would it be if you're speaking with your manager and they're asking what more support do you need in terms of your mental state? Oh, why don't you try this? Because it worked for me. You feel confident to try it out. Now, for managers, you need to begin to fix things for your team members. So when you're having a check-in with your team member the next time, why don't you ask things like, rather than asking, how are you doing? How's the work going? Ask, how can we redistribute work? Or is there something we can delegate to another person? What feels heavier for you than it should be right now? So we should also notice the patterns of chronic overload and make use of the resources that are available to us. For everyone here today, manager, foot soldier, cannon fodder, anything you are, I want you to remember that early intervention is always better than crisis management in any way at all. Once there begins to be a problem, speak up so that you can get the right kind of help. And this is how mental health should be tackled. Really, we know that in psychiatry, that when people, speak up about issues, early diagnosis means better prognosis for many of, mental health issues. So this should be our approach. Now, having spoken about all those things, I want us to think around this. Money gives people options. Now, in this case, you have health insurance in place, so that should not be a problem. But mental stability sustains the performance that you will be able to bring to work. And I want you to think around that because it's so important. When you're able to function properly, your cognition works quite well, and you're able to be more productive at work. And so I'm going to ask you, when are you going to let yourself have that? Finally, as I'm about to close, I'll ask this last question. What is one small change that you can make in your team to improve things and to reduce stress? Okay, so we're having some feedback coming. Delegate more. I love that. Better discussion with team members, I imagine. That's really great. Yeah, I think someone is still typing something. We'll wait for that person. Less anxious response. Amazing. I love that. Less anxious response. Some people, you tell them something has happened, they're like, we're gonna no, calm down, because every problem has a solution, isn't it? So then we think around it. Better responses come when you're able to sit down and problem solve, check up on people more, and to know how they're really doing. Yeah, yeah. Team social activities, amazing stuff. That's what we call here in UK, we call it away days. So that's really good. Get more hands to ease others. Yeah. So this is exactly what I'm hoping would have happened during this talk today. Right. So three things to remember. According to my objectives for the day, I wanted everyone to remember that stress can become dangerous. So from acute stress, moving into chronic stress, and then leading to burnout. So that is what we do not want. So we don't want our employees to be burnt out so that they can continue to be their best and be productive in our companies. I want us to realize that those high performers, please be sure that they're comfortable so that they do not burn out and then they leave in silence. Because when they leave, your company is going to feel it. And early intervention protects both your people and your organization as a whole in terms of productivity. I've put a top up for everyone here. If you scan this QR code, it will take you to a stress audit tool, and you can have that freely for your own download, and you can sort of check how you're doing as a person, individually. Thank you so much. Yeah, thank you. That's the end of my talk.